Hello, I'm a sight specialist in Southport with Dr. Nick Andrew. Nice to see you again.
Yeah, thanks so much for coming along.
Hello everyone, this is Yoko and this is Dr. Nick Andrew, my Superman doctor who helped my eye last year. That was so scary. So, do you want to introduce yourself, Dr.
Sure.
Andrew?
So Nick Andrews, my name. I'm an eye doctor based in the Gold Coast, and Yoko was one of my favourite patients. So one of my early patients last year when I first arrived from the Gold Coast. So Yoko and I go way back, and very happy to be here with you today.
So firstly, probably it's interesting to know what happened to my eye last year. Is that all right?
Yeah, absolutely. So, if you're okay with me sharing some information, all non-scandalous about Yoko.
And not my 3 sides.
That's right. We'll keep all of that to the aftercuts. So Yoko came with, had glaucoma, as we've mentioned, and had a laser procedure performed on the left eye, which was then followed by very high pressure eyes inside the eye. And so Yoko came to me with very uncontrolled pressure in her left eye. And it was quite a scary situation because that can cause permanent vision loss. And so we had on lots of medications with some side effects, and then we need to go to theatre. And so for the left eye, to do an operation basically to make a whole new drainage pathway for the eye to allow the eye to regulate its pressure and breathe again, and had to use a special device for that purpose, which basically is a very thin tube that goes into the front of the eye and channels the fluid from inside the eye up under the upper eyelid. And so that was performed on the left eye, and overall it's done really, really well. Then we had an issue with the right eye. The right eye then had elevated pressures as well, and so we had to then intervene on the right side. And on the right eye, I did a different approach because the pressure control we required wasn't quite as strong. So for the right eye, I actually did a different procedure, again using a small device, but this time much smaller. The device for the right eye is around the size of an eyelash, and that was basically done to optimize the internal drainage of the eye. So rather than making a whole new plumbing system for Yoko's eye, in the right side we were just basically unblocking the drainage pathway and optimizing her natural drainage pathway. Whereas for the left eye, we had to make a whole new plumbing system for the eye. So a little bit of work that's been involved, but Yoko's been a star patient, has healed so well, and had a nice outcome. So glaucoma, for those who aren't so familiar, glaucoma is a condition of high eye pressure. So the eye is inflated with a certain pressure, and that inflation pressure is good. It's important for us to see well, but if the eye pressure is too high, then that causes stress to the optic nerve.
So it's like becoming a balloon.
Like becoming a balloon, yes. Yeah. And that causes so that constant pressure though is transmitted to the optic nerve, which is the nerve of sight at the back of the eye, and that causes stress to it. So I say just like water dripping on a rock will gradually thin down a rock, so does pressure pushing on that optic nerve to gradually thin down that nerve tissue. And as someone's nerve tissue thins, we call that glaucoma. And over time, glaucoma will cause someone's peripheral vision to be lost. And so they might notice in the early stages, they'll actually have no symptoms. And then only when they see an optometrist or ophthalmologist and we demonstrate what vision has changed, then it becomes apparent. But the brain is very good at projecting and filling in the lost vision, which is why glaucoma is sometimes called the silent thief of sight, because patients won't be aware of the vision change that's occurring until they perhaps go to get their driver's license renewed, or until they start having accidents or bumping into things, and then all of a sudden they realize how much peripheral vision can have been lost. So that's the real problem with glaucoma. It's fairly asymptomatic until it's much too late.
Yeah, that was quite scary, and then because I had high pressure, I had so much headache as well. Yeah,
yes, okay. So Yoko is interesting. Your pressures were so high that you did have pain.
It wasn't 50.
Okay, an unspeakable number. So it was very, very high. So at that sort of pressure, someone will actually experience headaches and pain. That's unusual in glaucoma. Most people with glaucoma have pressures closer to in the 20s or 30s, and that is not perceptible. There's been no symptoms at those pressures. But once they hit the astronomical heights of 40s and 50s, people do become symptomatic. So that's a little bit unusual. So Yoko was aware and had headache sensation and pressure sensation around the eye, but that is unusual. Most people are not in the situation quite as extreme or catastrophic as what you were in.
That's unusual glaucoma. So what would be the normal glaucoma then?
There's a couple of different variations of glaucoma. Glaucoma is just the problem of elevated eye pressure causing damage to the optic nerve, but there's of course many mechanisms that can lead to an eye pressure being elevated. the two big categories that everyone knows about, or that people need to be aware of, is what's called open angle glaucoma and closed angle. So open angle means that the drainage channels at the front of the eye are open and fluid can reach them. Whereas closed angle means that the front of the eye is very, very narrow and very crowded. And there's the fluid is actually physically obstructed from reaching the drainage channels by the iris.
So closed one's more difficult to fix, is that right? And then did you say that's more higher rate for Asian people?
Yes. So closed angle is not necessarily more difficult to fix, but it is definitely more aggressive. So people who have angle closure glaucoma or closed angle glaucoma tend to come with much higher pressures, and they're at risk of having extremely high pressures into the 40s and 50s. And so they can have sudden onset of nausea and vomiting and headaches, and they can lose vision in just the space of 24 hours. So that is a very nasty form of glaucoma, which fortunately is fairly uncommon, but there are certain people who are at higher risk. So like you mentioned, yes, Asian patients, just the anatomy and the shape of the eye makes the eyes in general more susceptible to angle closure. And so that's something that opticians and ophthalmologists always need to be wary of, is screening patients for the how much space there is inside the eye to make sure that that person's not at risk of going into what's called an angle closure attack and getting very high pressures. Because that's one of the few things that people will actually call an ambulance for with glaucoma, is an angle closure attack.
So is that what happened to me, right?
Great question. So you didn't have angle closure. Your angles were still open, and the fluid was still able to reach Yoko's drainage channels, but your drainage channels just weren't draining fluid. There was too much resistance in the drainage channels, which is the far more common form of glaucoma, where the fluid can still get to the drainage channels, but there's resistance in those channels, and fluid can't drain from the eye as easily. Now, usually people don't reach the sky-high pressures that you reached. Usually it's more in the 20s and 30s perhaps, but Yoko is just a more extreme example of an open angle glaucoma.
Okay. So how do we know we have a symptom, and then what we have to be careful, I guess? Yes.
So this is the problem. So glaucoma is very hard to. So patients generally aren't aware if they have it. So the only way to be picked up is actually to see an optometrist. So everyone, certainly beyond the age of 40, should be seeing an optometrist once a year and have
over 40.
Definitely over the age of 40, yes. I think younger than that, occasional eye checks with an optometrist is wise, and that should be recommended. But over the age of 40, I think everyone should be seeing an optometrist once a year, just for an eye screen to make sure that the eye is healthy. And they'll obviously conduct a complete examination front to back, including measurement of the eye pressure and also just assessment of the health of the optic nerve. Because their instruments and testing is very sensitive at picking up early cases. And as long as we reach people early with mild glaucoma, then the outcome's extremely bright. And hopefully you won't have to be in the situation Yoko was in, where we have to rush to emergency surgery. Even though Yoko had a very nice outcome, it's certainly an experience we want to try and avoid for as many people as possible.
Yeah, you did something with a needle to my eyes. That was quite scary. So needle came into my eyes.
Don't terrify people. Yoko, don't say this. It's got to be a black box. It's got to be a mystery. It's got to be a mystery, yeah. So sometimes, yeah. So if the pressure's really high, we need to do some things to try and avoid it critically. Because when the pressure's 50, the optic nerve's under such stress that vision can be lost in literally 12 hours. So these can be true emergencies.
Another thing everyone probably want to know is, if your parents have a glaucoma, do you necessarily get it, or can you avoid it?
Yeah, great question. So family history is one of the strong things here. So anyone with a family history of glaucoma is statistically at elevated risk. So if your mum or dad or sister or brother had glaucoma, then technically your risk could be as high as 9 times the risk if you didn't have someone in the family. However, I don't want to overemphasize that either, because the longer we're living, glaucoma is typically a condition of the older people, and Yoko is not old. No. Yoko is not old. No. But it's typically a condition of older individuals. And
so
as we all...
How old? Like over 70?
Over 60, I would say, is when most patients will be on glaucoma treatment who require it. So the optic nerve does become more vulnerable to pressure in time. And therefore, as we all live longer, more and more people are being diagnosed with glaucoma. And therefore, I would just say that if you have a big family, there's going to be a couple of people in your family, usually, who have been diagnosed with glaucoma. And that's very different. That sort of soft family history of a couple of individuals in their older years using an eye drop, that doesn't really concern me. What concerns me when I see patients is if they have family history of people losing vision from glaucoma or requiring glaucoma surgery. That's a very different group of patients, and those patients and their families tend to be at much, much higher risk. They have more aggressive forms of glaucoma.
So sounds like it's very important to reduce or keep your eye pressure down all the time. So what would be the ideal eye pressure? Is that
So this is where the plot thickens and it gets more confusing. So the ideal eye pressure would be less than 21 millimeters of mercury. That's the average healthy eye pressure range in our community. However, though, and this is the other thing you asked about, Asian eyes, and certainly Japanese people have a much higher risk of something called normal pressure glaucoma. So normal pressure glaucoma is confusing because these individuals have normal eye pressures. So pressures at all times less than 21 millimeters of mercury. So normal pressures, but their optic nerves are undergoing glaucoma thinning. So every year the nerve undergoes progressive thinning, and we don't really understand why. It's basically felt that certain people's optic nerves are just much more vulnerable or much more fragile than others, and the nerve can undergo progressive thinning even despite having statistically normal pressures inside the eye. So that's the one problem with people. If you have a normal pressure, it doesn't actually mean that you don't or won't develop glaucoma. Even people with normal pressures can still have progressive optic nerve damage. And that's why it's important for people to be examining the optic nerves and just screening for these types of problems. And that's one thing actually that's much more common in the Japanese community in particular is normal pressure glaucoma, which you don't have. You had a different variant, but many individuals may be watching this. If they have glaucoma, you would probably fit in that category of either angle closure glaucoma or normal pressure glaucoma. And the treatment just differs just slightly.
So it sounds like it's quite difficult for us to judge ourselves, really, because eye pressure is really not high and there's no symptom.
So you're absolutely right, and unfortunately this is just the case. So very, very difficult for any individual to be aware of the health of their risk of glaucoma or whether they have glaucoma or not. It really comes down to relying on optometrists and ophthalmologists to be screening for this. Yeah.
So you should really go to optometrist not to just get new glasses, but then just for checkup. Is that right?
Absolutely. So that's really the role of optometrists, is not just to dispense glasses, but also to look at everyone they see and actually screen for eye disease, and not just glaucoma, but for diabetic retinopathy and cataract and macular degeneration and other problems that can affect the eye that some people won't be aware of. And so that's the whole role of an optometrist consult, is not just for glasses, but also for screening for eye conditions that are vision threatening or might require treatment.
So is there any a treatment or something we can take to prevent or maybe reduce the risk?
So this question is asked often. In terms of treatment or prevention, so unfortunately it's really just being screened and making sure that your eyes are being monitored. In terms of prevention, so not much. The things that do get discussed in terms of vitamin therapies, of vitamin B3 maybe has some role in patients with normal pressure glaucoma for protecting the optic nerve. I don't advocate that people start taking vitamin B3. You would only do that if you were recommended by an ophthalmologist and if you were in that small category of patients who would really benefit from that, but that is something. People often ask me about medicinal cannabis or marijuana. So this obviously gets a lot of attention in the media. So look, marijuana or cannabis will lower pressure inside the eye. That is actually well demonstrated. So the problems with it is it's not really a viable glaucoma treatment or a prevention because it doesn't last very long. The pressure lowering effect only lasts for a few hours, and therefore you would have to be smoking or ingesting cannabis regularly throughout a day to have a sustained pressure reduction. The amount you have to consume or ingest is high, so you would be intoxicated at that dose. It's expensive. Not that Yoko and I have any involvement there, but it would be much more expensive than taking an eye drop or even having laser therapy, and the effect tends to wear off over time. So cannabis isn't really a viable treatment for glaucoma at all. I think they will be looking at, or they certainly are looking at refining cannabis into eye drops, and I think we will see that as one day we'll have cannabinoids delivered as eye drops as glaucoma treatment. But at the moment, smoking or ingesting marijuana or cannabis isn't a viable treatment or prevention for glaucoma, much to everyone's disappointment. Yoko.
I'm I'm disappointed.
In terms of what we can do, I guess, if someone is diagnosed with glaucoma, in terms of the treatments, so we don't have a cure for glaucoma as such. I.e., we don't, if someone has a broken bone, I think we can cure that, but it is more like maybe a disease that we can suppress such that it won't cause any visual impairment in someone's life. So we can't completely cure, we can't reverse damage that occurs in glaucoma, but we can slow down its progression or maybe even stop its progression such that the patient's vision is preserved for the rest of their life. Now, as people live longer and longer, that means our goalposts have to keep getting tighter and tighter because people are living so long that we really need to keep strengthening our glaucoma treatments so that people preserve their eyesight for the rest of their life. The options for treatment are generally eye drop therapy, so using glaucoma eye drops, or using glaucoma laser. So that's a treatment done up in clinic, so not in a theatre, patient awake, just with some pulses of light energy to allow the eye to breathe more easily. Or doing glaucoma surgery. And if we do glaucoma surgery, there are basically two options. If we think of it like a drain, then you can either basically, like the drain of a sink, you can either unblock the drain, so do a procedure that's going to help the fluid to drain through the natural plumbing system more easily. That's using stents. Or you can make a whole new drainage system for the eye. So you make a whole new plumbing system. Now, those are the two different options. They come with different powers and potential, but also different risks. And so it's all about determining what sort of surgical procedure is appropriate for the patient or necessary, and weighing that up against the risks and benefits and how the eye is going to heal and behave. So Yoko is a perfect candidate. Had different procedures in each eye based on what each eye required. The left eye has a whole new plumbing system, so bionic woman on the left eye, with a whole new plumbing system for the left eye. The right eye just has the natural plumbing system rejuvenated, and in both eyes now has good pressure control.
So this is like a completely blocked toilet.
Let's use drain as a better analogy, but yes, we can use toilet. don't refer to your eye as a toilet.
Okay, all right.
And the right eye, yes, is like a drain with a stent in it.
Okay.
Yeah.
Okay, so that's a bit cleaner. Yes.
Okay.
Now it's very clear what happened to my eyes because I went to have a some MRI treatment for my body somewhere else, and then I've been asked that. So what did you do to your eye? I couldn't really explain much, but then now I can just explain, or I can just take this YouTube too. Yeah.
So all the devices that we use in ophthalmology around the eyes are safe in MRIs. It's a question we get asked all the time because ophthalmology surgery is becoming more and more involving small devices and implants and microstents and things, but these are all safe in an MRI. They will be visible though on the scans. And so you've got, Yoko, if I may say, has 4 devices in her eyes, would you believe? So on the left has a large glaucoma tube and a new artificial lens implant. And the right eye has an artificial lens implant and a small microstent about the size of an eyelash. So there you go, bionic woman.
Bionic AI. Oh, AI?
That's right.
Yeah.
Droid.
Android.
That's right.
Just change subject completely. Have you done your tax return?
Tax return. No, I haven't. We need to do it. Oh my goodness. Yoko, I'll come. Thank you. It's tax time. So
I think that was all. If you need to know anything more about your maybe eyes, maybe make a comment to us or visit your website.
Sure.
Yeah. And your office's clinic is in Southport, Gold Coast. Yeah, it's very nice. You get a nice coffee.
If you have any questions about the video, then feel free to just post a comment below. I'll log on and answer those. Hey, thanks so much for having me on. It's been fun.
Thank you very much. And we will look forward to seeing you again. Maybe bring Dr. Andrew Superman again if you demand.
We could think of some other questions. If you have any other questions that are interesting eye topics you'd want to discuss, I'm happy to. This is Yoko's idea. He had a lot of surgery here and wanted me to come on and discuss this.
Professional patient. So
there we are, professional patient. But if you have any other ideas, I'm happy to come on and discuss. So
great.
My pleasure.
Thank you very much for your time. Yes.
Thank you. Thanks, come on.
Thank you. Bye.